Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Joubert syndrome, and we are looking at the schizencephaly. So the first one being the Joubert syndrome. So in case of the Joubert syndrome, it is also known as the Vermean aplasia. It is a Vermean aplasia, or it is also known as a molar tooth. Midbrain hindbrain malformation. So it is a midbrain as well and the hindbrain. So midbrain and the hindbrain malformation. It is nothing but an autosomal. It is autosomal recessive disorder. So autosomal recessive disorder where there is a variable degree of cerebellar vermal agenesis. So there is a cerebellar vermal agenesis. Next is there's a prominent thickened elongation. There's a prominent thickened elongation. So this thickened elongation is a superior cerebellar peduncle, is nothing but the superior cerebellar peduncle, and it gives a characteristics molar tooth skin appearance. So molar tooth skin appearance is what is seen. So there is also presence of the bat wing appearance. This is of the fourth ventricle. To learn and grow daily like this, please do subscribe.